I'm Kelsey Creveling with the Consultants Counsel, and today we have the privilege of talking with Dr. Ron Jiménez. Dr. Ron is a dual-boarded physician in both pediatrics and clinical informatics, and he is also the founder of CodeScribe CPR, an augmented reality intellectual property startup that is changing how people learn how to give life-saving support via education. So with that, Ron and I have actually worked together for years in the consulting space, first joining together while working at Sagacious Consultants, and then at Accenture. And then through the years, we've stayed in touch. And most recently, I have joined CodeScribe as an investor and advisor. So really thrilled to have him here today to share his background, both from a physician perspective and as a consultant, and now most recently as a founder and entrepreneur. He brings a wonderful wealth of information to the table, and really excited to dig in with him and explore how he balances all of it, how he knows when to take on risk, how he knows how to handle the stress and strife, and how he knows when it's time to make a change in the course of his career. So we'll dig in now, and really excited to see what comes out of it. All right. Hello, I'm Kelsey Creveling. Welcome to the Consultants Counsel podcast and show. So excited for today. We've got Dr. Ron Jiménez joining, founder of CodeScribe. Super excited to have Ron here today. Welcome, Ron.
Thank you. It's great to be here.
Great. So with that, Ron and I have actually known each other for years and had the privilege of working together. So very excited to have Ron joining and sharing his perspective, both as a physician, but also at the intersection of consulting and technology and being a founder and being involved in multiple startups through the years. So Ron has always been a wonderful mentor and friend for me. And I actually have the privilege of also serving as an investor in one of his ventures. So just delighted, Ron, really glad to have you here. Glad to have you getting to share your perspective with the Consultants Counsel audience.
Thanks, Kelsey. It's really nice to be here and to share a little bit of sort of our history, but also a little bit of the perspective of being a physician in consulting.
Awesome. All right, so let's kind of dig in. You had an interesting path getting to consulting. Do you want to share a bit about how you ended up having some exposure to that world?
Sure. It actually was kind of a side door entry. I was working in the public hospital system here in Silicon Valley and had a wonderful relationship with a consulting group then who was working on strategic planning, technical work, and advising for the health and hospital system. And as we had a business relationship for a couple of years, one of those principals realized that I had some knowledge about information technology as a physician and invited me to participate in a consulting engagement with what was then a very groundbreaking technology, or the EICU, or telemedicine ICU technology, which was really new at the time. And it was a challenge, clearly, but I had all that I needed to provide the services that were requested. That is, an understanding of what an EICU does and is, and more interestingly, to define what a medical director of an EICU might look like, and to produce a job description. And I thought that was really fascinating. So, in fact, I was hired as an independent contractor for the company that was our consultant at the time, and it was all allowed and straightforward, and it was sort of an extra credit work, if you will. And the experience was just exciting. I realized that I could bring together all kinds of experience from both informatics and from clinical medicine to not only connect with other physicians around doing interviews and producing reports that they could understand and gain value from, but also provide insights that others on the team couldn't really have because they didn't have the experience of being within clinical medicine. So, for example, the impact of the information technology systems in the EICU world at that time were just proving themselves. And so being able to summarize and distill the scientific literature was really quite interesting. And so those are the kind of ways that I got into consulting, like I say, through the side door. And from then on, it was just sort of engagement after engagement and more complex problems to solve and to address. And this is very, very interesting.
That's awesome. Now, do you feel like consulting is a viable path for others who maybe have a medical background? Or is
Absolutely.
it something like, it was an interesting path for you to take, but maybe is not something for everyone?
Well, it depends a great deal on the individual, where the physician is in their career path, what their background is, and how they see themselves within the work world. One of the main challenges to physicians is not seeing themselves as physicians. That is, going from the bedside to the business world. It's really tough to do because the culture, if you will, of medicine sort of dictates certain things like writing orders and seeing patients every 15, 20, 30 minutes. In the business world, the pace is different, and orders are not really followed in the same way unless you're the CEO. And so one has to realize that in the business world, you have leadership skills that you need to acquire, management skills that you need to acquire, and an understanding of how a business works in order to fit into that business and produce value for the organization. It's a different way of being in a professional sense, but it can be very, very enriching in the sense that you bring to bear a unique set of skills as a physician, not just in terms of clinical skills, but an understanding of how the business of medicine is done. And when you can take that and apply it to a client's needs, it can be very valuable. You can provide great service to the client by understanding their problem, listening very carefully, and not solving it for them, but providing insights and joining them in the solutions as they grow, as they produce new strategic plans, that sort of thing. So it's not for everybody, but I don't think physicians should count themselves out of the consulting world just because they're physicians.
Sure. So there's a lot of consultants that work, for example, in healthcare, and maybe they have never interacted in that realm before. They're new to it and they're having to learn, and maybe they're intimidated by working with physicians. Any advice or recommendations from your perspective on how they can approach those interactions in a positive way?
Sure. Working with physicians can be difficult because, as I mentioned, unless physicians step out of the white coat and take on a more sort of business leadership position, it can be a little intimidating. But once an individual begins to see the doctor as a human being and another colleague in the business world, things can change. My own personal experience was, and I have a little bit of an advantage being a pediatrician, no one had to call me Dr. Jiménez. They could just say Dr. Ron. And that was a little bit easier to step into. Also, as a physician, not demanding that sort of recognition, but having a little humility about it and meeting people where they are and where their needs are, particularly if you have a team. If you're a physician consultant leading a team, you have to leave the physician part of it aside for a bit and really concentrate on the team, knowing your team, knowing how they interact, knowing what their capabilities and their needs might be. Getting to know them is probably the biggest thing you need to do. And it has nothing to do with medicine. So getting that sort of insight from your team can make a huge difference and allow you to support that team and move them forward. And then applying what you know about medicine, for example, if it's a healthcare engagement, to give them insights to succeed.
Wonderful. Thank you.
Sure.
So I'm curious, any interesting stories to share from your road warrior lifestyle and travel where your medical background actually served a very different purpose in consulting? I can think of a few that come to mind where I've relied upon, but I'm curious to to hear and share with others what those might be.
Well, there's a couple of instances where that made sense. Certainly, people ask you questions about their health, and you have to be respectful of what that question really means, which is, I'm worried about X. So giving informal medical advice is part of the job description in some ways. But there's also ways in which being a physician had sort of unexpected secondary benefits, if you will. I'll give an example that was kind of an unusual one, but it helped out. So when I started in clinical informatics 12, 14 years ago, this was a very small number of people who were doing this across the country, maybe a few hundred. And so as I grew into positions where that role of being the board certified specialist in the specialty that nobody knew about, I had to do a lot of education. So educating physicians about the role was part of what I had to deal with. At one point, I had a client who was really very reluctant to move forward with some of the recommendations that had been made. He was a gastroenterologist, a very, very learned colleague, very well respected in the field. And I remember having a very candid conversation with him and saying, if you had a broken bone, you'd go to an orthopedist. You have a broken electronic medical record. I'm that orthopedist. I'm a specialist in electronic medical records. You probably want to trust me. And that sort of candid conversation resulted in a change of mind that was really wonderful to watch, to see a colleague's perspective change and to see their horizon broaden professionally. In fact, that particular colleague went on to be a physician champion for the organization. And I counted that as a really significant win, because that was one of the things that the organization really needed, was not just all physicians to get behind the effort, but for a physician inside their own system to carry the banner and to help other physicians move on to the electronic medical record. Again, it was quite a while ago. And so that was a tough sell for most doctors.
Certainly. Yeah, it's interesting. Something I think that people who maybe haven't spent much time in consulting or haven't even spent much time in having to really manage others, they're not as familiar maybe with the fact that the people side of it is what takes up the bulk of the workload. You can have great services, you can have a great approach, you can have great products, but in reality, you will spend a considerable portion of the job on managing teams, on actually managing the personal events that may arise. And so that's where I've seen on a number of occasions having your expertise on the team has been of help. I mean, everything ranging from having team members with mental health crises and how to interact with them in a supportive manner and way, to dealing with injuries in the event of work excursions. I mean, things do crop up and arise, and those are not always what one would anticipate in the course of normal business functions. But when you are running teams and when you're interacting with people, inevitably the personal side will blend with the work side. And I know I've always fitted and enjoyed having your support, which is not normally what you're thinking you're going to be called upon when being a physician and a consultant.
The incidents that you reference are really profound in a certain sense. Being able to provide guidance to decision making around those kinds of events is pretty challenging. Taking care of your teams has many levels to it. As a physician, I'm certainly wanting to make sure that the health and well-being of my team is utmost there. But also carrying it even further, mentoring. I'm pleased to be able to share that a number of the folks who I mentored in consulting have gone on to medical school. And that's very exciting because they bring a very different perspective to the profession. And that's something that is, again, one of those secondary benefits I really didn't think was going to be, possible. But as people approached me, I remember having consulting colleagues, coming to me sort of privately and saying, so what does it take to get into medical school? And then to watch them ultimately not only make it to med school, make it through med school and get into residency and go out into the sort of specialty of their choice. It's very rewarding. It's an aspect of the job I wasn't anticipating, but was really satisfied to experience.
That's awesome. Yeah, I think that that's just something that people just getting into people management have not been fully made aware of, that there are so many levels to how you effectively manage teams and take care of them in ways that are necessary and oftentimes rather unexpected.
Right.
Emergencies are that for a reason.
Right. Agreed.
So speaking of kind of dealing with hardship in times, the consulting industry and really the work world as we know it, and our personal worlds as we know it for the last many years have been rather challenged. How do you find balance? How do you use the things that you're interested in to persevere?
Good question. There's certainly the self-care that's really important and that I advocate with colleagues. It is said that when you reach a retirement age, you don't look back and say, "Gee, I could have spent more time in the office." More often than not, one says, "I could have spent more time elsewhere with family, with pursuits." Striking that balance is challenging. Certainly, as I was in full-time practice and in various parts of my life, choosing to balance my personal life with my professional life, and for example, not becoming a partner in a practice that would have consumed my life. Still having the dedication you need to continue practice. Making choices is really important. You have to choose to take care of yourself. You have to choose to nurture relationships and friendships, build community where you can. One of the more interesting challenges over the last few years with the pandemic has been keeping community intact while working remote. And it takes a lot of effort, but it's really worthwhile because once the pandemic precautions have eased back, it's much easier to get back to that in-person community to reinforce that. And community is extremely important. You don't want to be the lone person out there working and feeling like everything is on your shoulders. You really do need others. And so part of that is expending the energy to keep in touch with people, to again, it might be something as a simple text, meeting someone for coffee, meeting someone for lunch. Those little things carry on and have great value in finding that work-life balance. At the same time, it's when you're working, work hard. Be effective at what you're doing. Don't shortchange yourself. But realize that you don't have to work till 1 a.m. to be successful all the time.
Yep. No, those are great points. And ones that are sometimes easier to adopt than others. I know I oftentimes struggle with the balance of making short-term efforts take over and in pursuit of goals. And so, being able to take that step back and to recalibrate and to remember what really your north is, if you will, and what is most important to you. And sometimes at a certain time that is career, that is focus, because there might be other extenuating circumstances going on where that is the priority, because it's going to then serve other aspects of your life effectively. And then
agreed.
Yeah, being able to take that into account and be willing to recalibrate anytime that you need to when you feel like things are getting off course and out of balance.
Agreed.
So then we had chatted previously about really when do you balance then the risk-taking side of it? You've been encountering a fair bit of risk recently with some big transitions and changes. Talk to us about how you
Sure.
dove into that and knew it was time for those risky pivots.
Good question. The risk you describe has multiple layers. There is the risk of transitioning from full-time practice to part-time practice, and now actually to being an independent contractor and being a per diem doctor. So I continue to practice medicine. I enjoy it. I love taking care of children. But part of the risk of moving into the corporate world is not leaving that behind, but finding a different balance. The risk of, well, let me couch it a slightly different way. I have been doing the work of creating intellectual property for a long, long time. Only recently has it come to fruition as a patent. So there's a risk of not doing what you're really built to do. I chose to do more of what I think I'm intended to do, to bring things into the world that have benefit to others, and create new products, new concepts, new ideas. It's risky on multiple levels there. That is, will you be rejected? I'm very pleased to say our patent was a fundamental patent and was accepted about a year ago, and approved rather in patent office, granted. And that was a huge risk on many levels. I think I'd have been crushed if we had been informed that it was already been done, seen it before. But the reality is it's completely new. That was very satisfying, but it was also very risky. As I've been doing this work over the years, I had not been able to really coalesce it into something like a patent. And now I get to do that on a regular basis in terms of working on these intellectual property projects. So the risk is relative to how you put yourself out there in many ways. I've decided to take the risk to move in this direction because it's been something I've been wanting to do for decades. And I've been very satisfied with wearing that risk for now and continuing to deal with the challenge of risk on many levels, whether it's financial, whether it's intellectual property, whether it's in the marketplace. And I'm up for that challenge. The interesting thing is that it doesn't feel as risky as it once did, I think because of our successes in terms of getting the patent granted. Now the challenge is convincing others that this is a great idea. And convincing them on many levels, whether that's endorsement, investment, et cetera, et cetera. And even that challenge I'm up for. So the risk, I also have to put it in the context of the other life I have as a physician. Risk in the business world is different than risk in the clinical world, and I have to keep that perspective. If I'm not successful in the business side, no individual person is necessarily going to suffer. On the medical side, it's a very different thing. So I weigh those risks very differently, and I see risk differently in the business world. I don't have someone's life in my hand. What I have is a business challenge. That's a very different risk, and it's actually a very welcome one in many ways.
Certainly. Well, it puts everything in perspective.
Mm-hmm.
And then I think that's a great thing for those listening, that, if there's things that you're scared of, you can use Dr. Ron's barometer here of, is it that you are just afraid of taking a chance, or is it actually life and death? And those are two very different evaluating criteria.
Yes.
So I love that. So Ron, you mentioned now you're in the position of needing to convince people what it is that you are creating and the value of it, and to generate investment and interest and progress. Convince us. Tell us what it is that you're working towards.
Sure. I've had a vision in my head for many, many years of impacting the field of CPR as an instructor of pediatric advanced life support many years ago. I remember thinking, this could really work better. And so I started down that road of trying to define what would work better. The place I landed last year, or a few years ago, and then ultimately in the patent that was granted, was we can do better at training people. We can make training, or at least the practice of CPR, and even doing hands-only CPR, we can make that happen anywhere. And that's kind of an audacious statement to make, but we're proving it. We can use, and we're in the process of developing the software, but in the proof of concept, but the ability to be able to teach someone basic CPR skills with just a smartphone is a game changer. And so we've spoken to the American Heart Association and others, and the idea is certainly there is great interest, and now we have to prove it. So what we're really up to is being able to let everyone who has a smartphone learn how to do CPR. The impact of that is enormous. With over 350,000 out of hospital cardiac arrests every year, and 90% of the time people don't make it. The ability to impact that and double or triple the survival if someone is just there to be able to administer CPR, that impact is huge. And that's really what we're after. We really want to impact the bottom line of lives saved and double or triple that survival rate for out-of-hospital cardiac arrests. We think that if we are successful in not only getting this in the hands of healthcare providers who can practice all the time, but also the general population, and even kids for that matter, we can make a huge impact on saving lives.
That's awesome. I love that.
That's really what we're about.
Privileged to be an investor in CodeScribe. I'm so excited for what it is that you all are working towards with everything that's really been making even the headlines in the news as of late. Hopefully it is becoming top of mind for the public, that we need better solutions for education, and that people really do need to know how to administer CPR. It is life-saving skill, and you never know when you are going to need it. So with that, then what's next for CodeScribe?
Well, we're in the midst of producing a proof of concept software and moving towards a minimum viable product. That's going to take a few months, but we're not that far away. The ability to have something that people can touch and feel in terms of an app is going to be huge, not only to investors, but if we can get the minimum viable product out on the App Store, we think that will gain a lot of momentum quickly, because it's something that is not really in the marketplaces yet. There are many variations of CPR assist applications, if you will, but none that I've seen so far that use augmented reality to really show you how to do it and to give you the feedback and the practice ability anywhere. And we envision being able to use any household items, a pillow, a rolled up yoga mat, anything that will compress appropriately, like a human chest, if you will, can be used. And that's as simple as it gets. So being able to let you learn and practice and do CPR in your home, in your office, in your workplace, anywhere, makes a difference. And that's really what we're about. So the next steps are really to get that software out there.
So if anyone listening is interested in learning more or getting involved, what's the best way for them to do that?
Our website, CodeScribeCPR.com, is out there. It has some information. Certainly you can get in touch with us through that channel, but you can also email me at ron@CodeScribeCPR.com. I'd be happy to have the conversation with you about what we're doing and how we're going to move forward. But go out and learn CPR. If you would just go out and learn CPR, you'll understand why we're passionate about this, why we want to make it possible for you to not have to go to a facility, to not have to go anywhere, but to do it in your own home. And that would be sort of a next step for you.
So then Any advice or recommendations for others, whether they be physicians or consultants or both, who maybe have an idea and they're wanting to see if it's viable and move into their own venture?
Yeah.
What thoughts do you have for them?
So for physicians, I run across physicians who often have great ideas, but lack the understanding of how to execute on that. And it's articulating a problem statement and what your solution is addressing. It's not seeing it through to the next level. I have the great benefit of having co-founders who have complementary knowledge. So I have a chief patent officer who's brilliant, a chief technology officer who's a wonderful consultant in his own right and has great experience in emergency medical services. So finding the right people to work with once you have an idea is really important. Finding the right validation is probably the next step. Making sure that your idea not only is unique, and in the patent parlance, non-obvious, and innovative is a challenge. You have to do that first. You can't just say, I've got a great idea. You have to really get behind it, research it, study it, find experts who can guide you. If you're not a physician, and you have such an idea, you really do need to research it. The patent office has a very good patent search system. Google Patent works very well also, if you know how to navigate the system. Research it heavily, make sure that you really are looking at something that is unique, and then realize that it's going to take time and money to get a patent through the system. It's a rather an uphill battle for quite a long time, and you have to be patient, but you have to be persistent, and don't lose faith. If you really have an innovative idea, you need to stick by it. You need to support it. You need to nurture it. You need to make sure that you're staking out that territory, and then running with it. Don't downplay your own ideas. We need more ideas. It is not the case that everything has been invented. There is plenty of space for new ideas and invention. The challenging part is getting it past the idea phase, and that's a great idea sort of conversation, to doing something about it and filing a patent and finding investors, and that's the hard part.
Yep. The motivation to continue. We can all come up with lots of good ideas, but being able to stick with it and see it through, that is certainly admirable.
Appreciate that.
Wonderful. Well, Ron, as you kind of look out over the span of your career and all of the different roles that you've taken on and the different experiences that have taken you many places, both physically and metaphysically, I guess. Any final kind of parting thoughts or advice that you would lend to this consulting audience?
Yes. Be aware of your trajectory. That's an odd sentence to bring together. But when I look at the trajectory of my career, it really would not have been visible to me from any point along the way, except that I knew I had to do the next thing. So when I was in medical school and I needed a specialty, I knew the next thing was going to be pediatrics. When I finished my residency, I discovered product design. And so I knew that creating new things was going to be the next thing. So over time, I applied to the Stanford product design program and was rejected. And that sent me in the direction of clinical informatics at the time. That trajectory was completely unknown to me. I actually got a chance to go back and thank David Kelly for rejecting me from the program, because it sent me off in the direction of clinical informatics, which was a brand new specialty at the time. So failure is not always the end. Failure is an opportunity to find a new path. And that's really what my trajectory was about, was finding new paths. As I moved forward and got board certified in pediatrics and clinical informatics, being a consultant was the next thing. Once I had worked in the consulting world for a few years, actually before I got to consulting, I worked in the academic world and was a medical informatics director at a large university, hospital center university. The next thing for me was starting my own company. And starting CodeScribe has been incredibly satisfying. Working with everybody, yourself included, has been just been a very enjoyable part of my trajectory. And we hope successful, both financially as well as in terms of impacting survival. Being aware of what the next thing is really important. So listen for what the next thing is, look around for what the next thing is, and be open to what the next thing is.
I love that. Things rarely come the way we expect them to. Our path is not typically going to be linear and direct. Our trajectory may feel like it's going this way, and then things arrive and crop up and take us in a completely different direction that actually is the one we're meant to be on. And what I've always found interesting is how things that feel disparate at the time that they're occurring, relationships, contacts, connections, experiences that you're having, they don't feel like they go together. But as you get the benefit of longitudinal time, it becomes evident how they've all actually been beneficial, because they've molded you into who you're meant to be for whatever it is that you're taking on. But they also bring a lot of opportunity that maybe would not have happened otherwise. It's fascinating to get to see how all those different strings come together over the course of time.
Very true. Very true. Well said. And true for my experience as well. I would have never guessed that I would have arrived where I am now. I would have never thought that would be the case, but I'm glad to be here.
Right. Certainly. Well, Dr. Ron, thank you so much for your time today. So glad to have you on the podcast and in this session. Really excited for what CodeScribe is working towards. It's always been a privilege to get to work with you and spend time with you. So thank you for joining us. Thank you for lending your skill set, expertise, and guidance. It is much appreciated.
Been a pleasure, Kelsey. Thank you.
Well, thank you to Dr. Ron Jiménez for joining us today. So excited for that conversation. It's always fun getting to talk with Dr. Ron. He just has such a wealth of information, and he also provides quite a lot of levity. I always appreciate his perspective because he is so thoughtful and considerate with how he approaches decision making, how he approaches interactions, and how he elects to move forward. He has always served as a wonderful mentor and advisor for me personally, as I've gone through and built my career. And as a result, I love what he was able to share here today with you all. I think there's a lot of wonderful lessons and opportunities to really take a look at and examine how you can leverage some of his experiences as you work to navigate your own. So with that, thank you so much. Hope you have a delightful and wonderful day. Thank you for tuning in to the Consultants Council.